The World AIDS Day has become an opportunity for public and private partners to spread awareness and encourage progress in HIV and AIDS prevention, treatment, and care around the world. You're watching The Last Mile with NACA, and I am Adesua Osuyi. This episode brings you highlights of the technical sessions leading to the 2022 World AIDS Day, where stakeholders from across disciplines gathered to promote a concerted HIV response. Stay with us.
As part of activities to commemorate the 2022 World AIDS Day, the National Agency for the Control of AIDS, NACA, and partners organized several stakeholders' engagements and technical sessions to reflect on the HIV and AIDS journey thus far, review the status of the response, and share the vision to end the epidemic by 2030. First was a pre-launch event of Gen N, an initiative aimed at contributing to increased uptake of HIV prevention, treatment, and care services by adolescents and young people, or AYP, in Nigeria. The Deputy Director, Behavioral and Social Change Communication, NACA, Dr. Daniel Ndukwe, gave an overview of the initiative.
Gen N is actually power of synergy. It will unify different calls to action under a single national banner. Some people have asked us what happened to all the AYP interventions in various programs, various funds. This is not to replace them, it's to bring them together. All right, because Nigeria is such a big country, no one individual can saturate over, if adolescent and young people over 50%, you are talking over 100 million Nigerians. So but we want to have a dashboard that will show us where you are, what you are doing, so that it will be easy to identify the gaps you have, and we can plan together to fill those gaps. It will bring all youth-focused HIV communication under one umbrella. All intervention will enjoy reach beyond their intervention because we create synergy.
There were goodwill messages by partners, including representatives of UNICEF and Society for Family Health. A panel discussion on the increase in cases of new infections among young people discussed challenges affecting the uptake of HIV prevention, treatment, and care services by this key population.
Most people don't believe HIV exists. Some of them feel it's just a way for our parents to scare us to stay off sex. And the other 50% that believe that there is HIV, they feel those that have HIV are surely going to die. Either you take your drugs or you don't take your drugs, you're definitely going to die. They feel your life is already at a standstill. I have a friend that lives with HIV and she says, I'm going to get everybody infected, since my parents got me infected without my permission. So I think the stigma is making them want to spread the virus more. So I think there should be more awareness, and we need to spread more love and light.
People doesn't have the information, people doesn't have the knowledge, or there's even economic issues that people doesn't have. They have barriers to access those services. So I feel we're doing something wrong. Despite, I think, in the adult, we have a lot of progress in this 4 decades. But I think we have an issue in making sure everybody is carried along, which is aligned with, I think, the topic in equalizing. So I feel the community need to be sensitized and bringing everyone on board to make sure everyone is accessing these services in prevention, treatment, and care. So I think we are having a problem in especially this adolescent and key population.
Gen N is a welcoming idea, and I see it addressing a lot of issues around stigma. I see it addressing a lot of issues around you equals to you, because Gen N is actually promoting PrEP use amongst young people, right? And then we have a lot of young people living with HIV that are asking questions. How do I go into relationships with negative persons, right? And now, with Gen N, we have a lot of young people that will be empowered. They get access to PrEP, and they are able to stay safe from contracting the HIV virus. So with Gen N coming in, it will give a lot of young people courage and have young people living with HIV go into healthy relationships with negative partners without the fear of stigma, without the fear of being discriminated. So with Gen N coming in, I can protect myself as a girl child, I can protect my future, I can secure the best life for myself.
What we want people to know is that there is an act against HIV, stigma, and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a number one enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
Still related to young people, stakeholders were gathered for a youth dialogue centered on the theme of the 2022 World AIDS Day, equal access to treatment and prevention services. The event commenced proper with goodwill messages from representatives of partners, civil society, community and faith organizations, and other relevant stakeholders.
We have today all the tools in our hands in terms of information, in terms of treatment, in terms of prevention. But one thing still remains: new infection still occur among vulnerable persons, especially youth. So the theme of this World AIDS Day is to equalize. Equalize, in other words, means to give chance to everybody, to remove the barriers so people can get access to treatments, people can get access to prevention, information, and so on.
The HIV and AIDS specialist and adolescent teen lead of UNICEF, Dr. Victoria Isiramen, delivered the keynote address.
In the new National Strategic Framework 2022 to 2027, there are two strategic thrusts. One is to prevent new infections, towards zero new infections and zero stigma and discrimination. That's the first strategic framework. Whatever it is about new infection, Nigeria wants to do. So we're asking, in these new infections, where is it happening? How are the issues of young people addressed? The second strategic thrust is towards zero AIDS-related deaths. So in the whole of the HIV response, Nigeria is looking at these two big areas as strategic thrusts. But then there are also other cross-cutting issues. So gender and human rights for women, for key populations, and other people that have been left behind. Health and community system strengthening, that's the big area also. The HIV response wants to ensure that the health and community systems are strengthened. And we are saying, how strengthened are they for adolescents and young people? How much integration of adolescent-friendly youth services are at the facility? Investing in young people makes a demographic dividend because of the numbers, the sheer numbers. We invest, we do effective multi-sectoral coordination, and then meaningful youth engagement.
Mainstreaming mental health as part of the minimum package for AYPs was the keynote address by Temitayo Oyedemi of Positive Action for Treatment Access, PATA.
Mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. What is HIV and this mental health that we are talking about? Stigma of mental illness worsens health outcomes for PLHIV, especially AYP. Many AYP plus have been on ARVs, like we all know, long time and experiencing drug fatigue. Mental health conditions extend to adulthood, impairing both physical and mental health and limiting opportunities to lead fulfilling lives as adults. Adolescents with mental health conditions are particularly vulnerable in social inclusion. Acute stress weakens the immune system and can make PLHIV susceptible to other illnesses. So, what are the suggestions for providing mental health counseling and support? Fund mental health trainings and initiatives as part of routine PLHIV care. Provide ongoing therapy support for the first 1 year after testing positive. Provide AYP with therapy for as long as they need it. Therapy for treatment adherence, therapy to address HIV stigma, therapy for pregnant women with HIV, support online therapy for all young people. COVID has made it easier. We know that we do not have to sit in the same room anymore. You can actually do that virtually.
Treatment and adherence, challenges AYPs face, capacity and operational development needs of healthcare personnel and facilities was the topic of the panel discussion at the youth session.
From the very onset of designing things or designing programs that are addressing the issues that young people are facing when it comes to their sexual and reproductive health, including HIV and AIDS, it's that we need young people to be the ones leading those processes and driving those processes. So they are the ones who are, sharing how their perspective on the issues, their perspectives on, what can be done to address it. So for that to happen, we also need to have young people who can, articulate these issues and present them when they have the opportunity. We are all talking about improving policies, improving laws to make sure that young people have access. And it means that they have to be in those policy-making spaces. They have to be in those spaces where these conversations are had so that they can adequately reflect their realities. And it will not be other people speaking on their behalf. And so those are the areas where we come in with capacity strengthening to ensure that young people have the advocacy skills, the communication skills, the presentation skills. And when they find themselves in those spaces where they can make, those presentations, where they can make their issues known, they are able to present it in a way that, they can influence the conversation positively, and they can influence the outcome of those conversations. A lot of young people, despite the fact they have accepted their HIV status, they still go through, there's what we call post-trauma. They come back at some time, it hits hard that you keep thinking that, for the rest of my life, I have to live with this virus. And sometimes they keep asking questions to themselves that they don't get answers, because most times their HIV status is not disclosed to them by either their guardian, their parents, or healthcare providers. So they keep having these issues of post-trauma, and it affects their mental health. Again, access to comprehensive sexuality education. This is something that if young people are able to have access to comprehensive sexuality education, they get to learn about their sexual reproductive health. They get to learn about HIV and AIDS, the modes of transmission, how to get protected, and all of that. And at that stage, you get teachers or guidance to groom young people to understanding that HIV is not a death sentence. Then lastly, I would say taking ownership. A lot of young people are shying away from taking ownership. A lot of people are shying away from sharing their experiences to bring about change around the situation where we have stigma. Yes, it's difficult. But when we have a lot of young people coming in solidarity, coming in one voice to say that, yes, this is something that burdens us, how do we go about it? How do we make sure that this issue is being changed? So until we tell ourselves that, yes, I can do it despite my HIV status, despite my
whatsoever you want to put it, I can still make a difference. So it's taking ownership and taking leadership space when given the opportunity.
Other panel discussions held at the events featuring representatives from NACA and partners centered on mental health and wellness, as well as the role of government and partners.
We all know festive period is a time to loosen up. We all have fun, lots of hangouts.
However, statistics show increased indiscriminate sexual activities over the holiday period.
Unfortunately, this also means more people are getting sexually transmitted infections.
One gift I will never love to get during this festive season is that of HIV infection.
So, celebrate this holiday responsibly and with caution.
Avoid anything that can lead to new infections, impacting the progress made in the fight against HIV and AIDS.
Your New Year resolution should include knowing your HIV status.
Get tested for free today.
Brov, babe, share love, and not HIV infection.
The panel discussion, Gender and Rights Dimensions in HIV Testing and Treatment Uptake, the Nigerian Context, was moderated by the Deputy Managing Director, SFH Nigeria.
I think some of the things that the government has done well is, first, I would say that there's been lots going on, led by NACA, looking at gender and human rights as well, which PEPFAR has been supporting. There's also been engagements, open and very clear and strategic engagements with all stakeholders, including communities, CSOs. What can be done better? On policy level, we need to begin to move beyond the general program, looking at what our national surveys, assessments say to us, but be more context specific. So how are we conducting gender analysis in communities and states that we work beyond what we have, with, at the national level, so that we are able to then come up with gender responsive interventions that address specific, nuanced, context-specific, socioeconomic barriers, social barriers, gender-related barriers that affect men, boys, girls, and key populations, within the communities that we work.
When you look at the dimension of services, it's very important that we look at the humanity itself, because we are diverse in nature. So we can't use one size fits all for everyone. So if we are talking about testing, what is making the vulnerable groups not to go out for testing? So which means if we are strengthening the facility, we also need to strengthen the community. If we are training professionals in the facility, we also need to train paraprofessionals at the community. Because in the first place, those who are marginalized, the reason why they are marginalized is because of access. How do we need to bring the access at the community level? If we are talking about young people, there are young people who are key populations. So if we are thinking about sexuality education in school, are we also thinking about sexuality education that is also embedded into vocational trainings that is happening not in the four walls of the school? So those are the gaps that presently that we have. And if key populations are not going to the facility, which means their children are not also accessing services. So how are we also including the services of their children in where they are also much more comfortable in getting services?
Finally, a United Nations Office on Drugs and Crimes, UNODC, and the Global Fund supported technical session. The welcome remarks was delivered by the country representative of UNODC, Oliver Stolp.
Reducing HIV/AIDS infections among key populations and reaching them with life-saving treatments remains a challenge that we cannot afford to fail. Ladies and gentlemen, it is against this backdrop that we have gathered here to address the needs of one of the key populations that continues to be particularly badly affected by HIV/AIDS, namely women and girls who inject drugs. The HIV prevalence rate among this specific group stands at more than 15%, thus demanding our urgent attention. We are most grateful to the Global Fund to Fight AIDS, Tuberculosis and Malaria, and the National Agency for the Control of AIDS for allowing us to provide technical support to development of this important tool. Ladies and gentlemen, let me use this opportunity to also congratulate the government of Nigeria for having integrated law enforcement officials into the national response to HIV/AIDS.
The Director of Community Prevention and Care Service, NACA, Farm Alex Ogundikbe, delivered the opening address on behalf of the Director General, NACA, Dr. Gambo Aliyu.
The 1.9 million Nigerians that are infected, we have about 1.7 of them enrolled on treatment. And if we're able to sustain them on that treatment, then we can reduce their viral load to a level that is undetectable. Of course, getting to the end requires more efforts, more resources. And by looking at the issues that surround it, we realize that there are barriers that exist, barriers of capacity, barriers of stigma, barriers that are economic. The DG wants me to convey his appreciation to everyone and that all hands need to be on deck towards ending HIV as a public health threat by the year 2030. And the right way to go is for all of us to remove the little barriers right from the home front to the facility, to the detention center, to the way we treat people accosted or arrested, and to grant them access to the extent possible.
There were goodwill messages by some stakeholders present. The panel discussion was on addressing inequalities that fuel HIV transmission among key populations.
What has the implementing partners, what have we done to ensure that the target population are part of the program, community-led programming? So gone are those days when IPs sit down at the round table and design program based on what they think is on the field. But nowadays, you now see that the target population, when you talk about KP, when you talk about AYP, with all the various typology of the targets that key population work with, you see that they are part of the design, they are part of of the implementation, and of course the evaluation of the programs that have been implemented by IP.
I see inequality from a sense of a young woman living with HIV or a young person living with HIV being able to economically sustain and economically provide for themselves. So I think that's also a gap. For the young women, you can believe with me that we still have a society against them. The social norms is still there. The cultural and social belief is still there. A young woman finds it difficult to even find love or to even find husband these days. And I know, yes, we're in the era of couples where one is positive and then the other one is negative, but that also has not really sink deep into the community. So I think that's another inequality gap we need to address, and access to sexual reproductive health and rights services. That is also a gap, even though I can say we are doing a lot, but we still need to scale some of these things.
The World AIDS Day has become one of the most widely recognized international health days and a key opportunity to raise awareness, to commemorate those who have died and celebrate milestones in the HIV response.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. equalize to end AIDS by 2030. Thank you for watching. For more on the HIV response, follow us on our social media platforms at NACA Nigeria and subscribe to NACA TV on YouTube for more. Till next week on The Last Mile with NACA, know your status and take action. I am Adesuwa Osi. Compliments of the season.